Hey, everybody. Welcome to a special edition of Pick Dr. Osborne's Brain. I've got a fantastic guest. We're waiting for her to join our meeting. And so in the meantime, just sit tight and we'll be with you here in just a few minutes. Again, you are live with Dr. Osborne, and we're going to be talking tonight with our guest, Trina. She is a oral health expert. She's a nurse and she's the owner of Primal Organics. And we're going to be talking with her about oral health, how to heal your cavities, how to remineralize your teeth, gum disease, and a number of other oral health related topics. So stick with me and we'll be right back. Hi there.
Hey, how are you?
I'm doing great. How are you doing?
Good, good.
All right. Thanks for joining us tonight. We're streaming live already. So welcome.
Yay.
Yeah, welcome aboard. We just dove right in. This is our first, you're our first Zoom software live. Usually we've used other softwares in the past. So we were working.
Oh, good.
But yeah, thank you so much for joining us tonight on Pick Dr. Osborne's Brain. I'm really excited to talk about oral health. I know it's a passion of yours, and we've had prior conversations about it. So I'd love for you, if you wouldn't mind, just introduce us. Let us know who you are and kind of how you came into starting Primal Life Organics as a passion.
Primal Life itself started because back in, it's 2007 now. I graduated from anesthesia school. I'm a nurse anesthetist. And my fiance at the time, husband now, and I went to get married, and we went to Fiji because we figured we're going to start a family. I was turning 40 at the time, and we knew we wanted to start a family, so we wanted to go somewhere really cool. And we got pregnant on the honeymoon. And when I got back to the United States, started work as a nurse anesthetist, at week 7, I miscarried. And it kind of just took us both back because we were both healthy. This was before paleo, but we were still very healthy, worked out. I, as a nurse, I knew that miscarriages can happen for a lot of reasons, but we really took a deep dive into our environment. And it was at that time that, we changed our laundry detergent, we changed our cleaning supplies. Never dawned on me that my skin and body care products were contaminated with just toxins, neurotoxins, cancer-causing ingredients. And so we got pregnant again right away. And that's when I realized, as I was getting ready for work one morning at week 7 of my new pregnancy, and I looked down at a moisturizer and I realized that it was full of toxins. And it is at that moment that I disconnected from what I call big Cosmo, and I started creating all of my skincare and dental care products. So that's how Primal Life was really born. And then, it just grew. I started making it for myself. People started loving it. I was giving it to friends. And then when my daughter was a year old, we launched Primal Life.
Awesome. So tell me, your experience in the oral health field really started out of a personal need. What do you have a story you could share with us in terms of cavities? I know we talked a little bit about that, and I'd love for you to share that.
Yeah. My daughter at the age of 2, everything like wrapped around my daughter with this whole company. It's just interesting. But at the age of 2, Mia had a tooth that came in, and I love to use props. So I've got my big tooth here. Everybody can see it. She had a tooth come in. It was a molar, way in the back, a molar that needed to, the lifespan of that molar was going to be until she was around 12 years old. And the molar came in, and when we were brushing it, my husband noticed something was wrong with it. So he called me over. I took one look at the tooth, and I'm like, I have no idea what that is. So we took her to the dentist. He took one look at it and said, that's a natural defect. It's a natural cavity. It occurred during development in utero, which I didn't even know could happen as a nurse. I had no idea. And I guess this can happen typically when mom has some sort of like infection or has a fever or high stress. And at the exact time that that tooth is being developed, usually it happens to both teeth because two teeth, one on each side, is being developed at the same time. But luckily, only one of hers was affected. But he said, I'll never forget it because he said, you know, we'll put a temporary filling in it because she's only 2. The temporary filling is only going to last 2 to 3 months. Every time it falls out, we'll decide if now is the time to pull the tooth. So he said, most likely the tooth will be pulled by the time she's within a year. So by the time she turns 3. And as we were leaving the dentist office, they put a temporary filling in. She did fine. We're leaving the dentist office. He knew I was a little frazzled by the whole thing. So he said, don't worry, mom. We put a temporary filling in and now we just hope for the best. And I just thought, there is no way this mom is going to hope for the best. So that's when I did my research. I went home. I'd already been making skincare products and face products. And I just went home and I started researching oral health and, you know, the best way to protect the teeth and healthy gums. And I was astounded by what I discovered, which was Dr. Weston A. Price. And I know you're familiar with him. And he was a dentist, early 1900s. I always say way before his time, because his research is things that a lot of us know, but the majority of the public out there have no idea that this all was discovered way back in the early 1900s. The link to cavities, the link to gum disease, the link to heart disease and Alzheimer's, the link of sugar to all of this, all the inflammatory processes that happen inside the mouth. He discovered all of that. And he discovered what really makes sense, what works inside the mouth, what needs to happen to keep the mouth healthy. And so I took his research, and that's what I used to develop my entire dental program to keep the mouth healthy as the basis of internal health. Oh, and Mia, by the way, to end that story, I always forget to end the story. So I created my dirty mouth tooth powder. We'll get into like what good dental products look like, but I created that. We used that on her. That tooth that was supposed to be pulled within a year fell out naturally at the age of 12. I got the whole entire lifespan of that tooth. I was only aiming for 1 year and 1 day. I thought if I get that tooth 1 year and 1 day, I'm good. But it lasted, that tooth stayed in place, the lifespan of the tooth. And then the actual filling that he put in, that first filling that was supposed to fall out in 2 to 3 months, was in place when the tooth fell out. She never had any other dental work done. And the tooth had remineralized over that filling. It had actually put in minerals in place to protect that filling so that bacteria couldn't get underneath the filling, making it needed to be replaced or pulled within a year. So we had great success with that tooth.
Yeah, that's amazing. That's amazing. I mean, we always hear, you know, you get, if you have a cavity, either you've got to fill it, or if it's bad enough, the tooth has to come out, or there needs to be a root canal. I mean, there's this kind of traditional mantra that so many people have told, and it reminds me a lot of medicine, like traditional medicine versus functional medicine. It's like you get a diagnosis, and then somebody wants to prescribe you a medicine to treat your symptoms without asking why the symptoms exist in the first place. And that's really what I would love you to go into this evening as well, a little bit about the causation. Like what are people's options, and what can they do if they do have cavities and they're being told that they need a procedure, or they need to have, you know, a bunch of toxic compounds possibly embedded in their mouth. Because that's one of the other things. Like when people come to see me, we test them to look at what they're allergic to before we send them to a dentist to say, hey, fill them with this, right? Because if they're allergic to the filling ingredient, that can be a trigger for an autoimmune process as well. So talk to me a little bit about that, if you don't mind.
Absolutely. And your mouth, like, I always call it mouthing off with Trina. This is one of the reasons. Your mouth is so close to your brain, your pineal gland, your salivary glands. There's a lot of stuff that's directly connected or very close to your mouth. So making sure that your gum tissue is healthy and that your teeth stay healthy is extremely important, and using the right products, getting rid of the toxins. If you have sensitive teeth, or you have, you're in need of a cavity, like if your dentist tells you that you have a cavity that needs to be filled, what I usually tell my customers, of course I can't diagnose, I can't tell them what to do, but when I give them my suggestion, I always tell them, if there's no pain or very little pain, if it's tolerable and there's no infection, then you have the time or the chance to be able to heal that tooth or to remineralize the tooth. And the same goes with the gum tissue. I've had customers of mine that have had really bad receding gums, needing gum grafts, according to their dentist. And they've used some of my treatments. I have a red and blue LED light that we could talk about. That the red light is so good inside the mouth. It increases blood flow, reduces inflammation, increases collagen production, that within a couple months, I know one person who went to the dentist, had really bad, they were talking gum grafts, gum tissue grafts. And that's to protect the roots of the teeth, protect against bacterial infections and things like that. But within about 3 months, she was going every 3 months because everything was really going downhill fast. Within 3 months, the only thing she changed was using red light therapy. She didn't change anything else. And within 3 months, she was 70% improved on her gum tissue. Was no longer a threat of needing a gum graft. Her gum tissue was actually starting to regenerate and looked much better, wasn't inflamed. So I usually say that there's, just knowing that there's an option out there, that there are things that you can use that are natural and that will work inside your mouth to change the environment inside the mouth. And I do have a presentation, like some slides that we can go into that will have a little more, you'll get to watch something graphically that has diagrams and things like that. But it really is about the environment inside your mouth. And if we don't change the environment inside your mouth, it doesn't really matter what we do with the tooth that's having problems, because you're only going to cause problems in everything else. Your gum tissue and the other teeth are in the same environment. So acids are really bad, and acidic environment's really bad. And unfortunately, in this day and age, almost all of our food is acidic, especially gluten and processed foods are acidic by nature. Even red meat, even if you're eating a healthy diet, red meat, is acidic by nature. Most coffee, tea, drinks, things like that are all acidic. Anything with sugar is going to be acidic. It's going to feed the bacteria. And even if the food isn't necessarily acidic, but has sugar in it, that feeds the bacteria then that creates lactic acid. And then you end up with the acids inside the mouth. So we need to do something to shift from an acidic mouth over to an alkaline mouth. An alkaline mouth is what's going to prevent the growth of the wrong bacteria. It's going to help with the gums healing and prevent the gum breakdown, the gum tissue breakdown as well. I always tell people, I suggest if you get, information from a dentist like that says you have a couple cavities, they need to be filled, or your gum tissue is not looking so well, I usually suggest getting a second opinion from a biological dentist, because a biological dentist is going to be more in tune with whole body health and how that relates to your whole body and what you can do, what types of things you can do to help prevent the worst case scenario from happening, or even just getting a cavity filled. Or if you do need a cavity filled, using, like you were talking about, materials that are not toxic to the body, that are more compatible with the body. The problem is these things off gas, metals off gas, and things like hydrogen peroxide can break down or cause them to basically fumigate, and we don't see it, you don't taste it, you don't really smell it. But especially amalgam or the metal fillings, anything with peroxide, if you're brushing with peroxide, using whitening gels that have peroxide in it, it vaporizes the metals and they enter your body through your breath, because of course your mouth is connected to your nose, which is connected to your sinuses, which is connected to your lungs. You ingest them, connected to your gut, and then as well as your bloodstream. If they get into your gum tissue, it goes directly into your bloodstream, which then travels throughout the body, because your bloodstream inside your gum tissue is going to travel back to your heart, which then pumps it everywhere, which is why the mouth is connected to every organ. It's the bloodstream is going directly back to the heart to be pumped to the brain, to the lungs, to the kidneys, everywhere. So that's why it's really important inside the mouth. And then with the pineal gland and the salivary glands, of course, that's extremely important in whole body health. So I hope that answered your, your question.
It does. And actually, I'd love it. I'd love it. If you have your slides, you can put them up. I can allow you to share them, or I can put them up either way, whatever.
Yeah, I can put them up. That
way
way I can move them when I need to. So yeah, I can
Yeah.
screen share. Let me see. Here we go. All right.
Perfect. There we
You
go.
can see this. All right, let me do the slideshow. Presenter view. Let me see, play from start. We'll do it this way. That way it's the whole screen. All right, you got this, right? You can see this?
I can. Yep.
All right. How do I like to call this how to achieve, or how a dirty mouth can help you achieve an orgasm. I'll talk about an orgasm in a second, so don't like go, oh no, what is that? But a dirty mouth, I play on words here. Dirty mouth basically means that sometimes what we're using is an overkill. It's over cleaning. It's sterilizing the mouth. Think about when you take an antibiotic, you know, even for 7 days when you've had an infection for some reason, and you end up with diarrhea, you end up with constipation, you end up with a sore stomach or, you know, tummy ache. It's because you end up killing all of your good bacteria inside your gut. And now it's a dysbiosis. You have bad bacteria that overtakes it. The same thing happens inside your mouth when you're using products that are sterilizing your mouth. And, you know, by sterilizing, I mean alcohol, triclosan, sodium lauryl sulfate, peroxide, things like that, that kill everything. So you do want to have a slightly dirty mouth with good bacteria. And then I'll move forward and tell you what an orgasm is. We kind of came up with this term, my team and I, as we were kind of describing, we had a customer describe what the sensation was when they used our products and ended up with healthy bacteria inside their mouth. They said that it feels like they're having an orgasm twice a day when they brush their teeth. And we loved it. We thought that was amazing. So it kind of stuck. So when your bacteria is healthy inside your mouth, you end up with the right balance of good and bad bacteria. The bad bacteria is what gives you that foul taste, that foul smell. You go running for gum, you go running for breath mints, which aren't going to do you any good. You really need to reestablish a good bacteria, a good microbiome inside your mouth. And I'll go into that in a minute. But, you know, a little bit about me. I'm a registered nurse. I've been a nurse since, 1994. So quite a while now. I'm the CEO of Primal Life Organics. I created everything in my kitchen. I created everything by hand. All of the recipes are made by me, formulated by me, and we still do make everything by hand. I'm the best-selling author. Beauty's Dirty Secret is a book that I go into more detail about skin and dental products. Beauty, I always say Mother Nature has a dirty secret. The beauty industry has a dirty secret, but Mother Nature has some dirty secrets as well, and her secrets are amazing. So I kind of give you a lot of information about the beauty industry, as well as how Mother Nature actually takes care of us if we just use her products. And I'm also a registered nurse and a mom, and been featured on a couple programs with my dental products. First of all, when I was talking about my daughter, and the reason I was so upset when he told me we would most likely have to pull that tooth is because I know every tooth in the body is connected to an organ or a group of tissues. And when you look at this chart, you can see that like her tooth was, it was probably tooth number 7 in the back, or 6, one of those as a baby tooth. And so you can see it's connected, 6 is connected to the spleen. What this means, if you don't know what the tooth meridians is, it's like the meridian channels for acupuncture, acupressure. It's this channel. I always like to say it's like a two-way channel of communication. So when you were being developed, every tooth was being developed at the same time as an organ. So that's where that connection comes from. So it's a two-way street. If you're having a problem, say with your spleen, you may not have any symptoms from your spleen or stomach or small intestines. The teeth right around it can be affected as well. But what might happen is you might end up with a toothache on tooth number 6. And if you end up with a toothache and your dentist can't find anything wrong with that tooth, this is where the chart comes in helpful. You can go to your doctor and say, hey, can you check my spleen? I'm not sure if I have a problem with it because I'm having a toothache. They might think you're crazy, but I'm having a toothache with tooth number 6, and it's connected by the tooth meridians to my spleen. The reverse is also true. You could be having a problem with your tooth, say tooth number 5, and you might be getting stomach aches every single day, but your tooth doesn't hurt you. It could be in the gum tissue where the tooth, in the root of the tooth, inside the tooth. You might not even have any pain, but you might be getting stomach aches that nobody can figure out why. And so that's the opposite connection, is you could be having stomach aches signaling there's a problem with tooth number 5. So it's just good knowledge to know that this is how the body was developed, and it's a communication tool, and it's also just something for you to be aware of. There's plenty of websites that are interactive. You can connect to a tooth and it shows you which organs, and it goes into a little bit more detail. But I just wanted everyone to be aware that this is out there, and it's just another tool that you can use. But it was the reason, as I was walking out of the dentist office, that I was like, oh my gosh, I don't want that tooth to be severed. This is why root canals, if you have to have a root canal or a tooth pulled, try and do it only as a last resort, especially if the tooth can be saved. This is why biological dentists are usually more apt at wanting to save a tooth, because they really understand the connection with the body. And then this is where I typically go into my story about my daughter and her tooth. So I'll skip this right now since we went into it. I like to say good health starts inside the mouth. And you may have heard that growing up. I know I heard that. I had absolutely no idea what it meant. And now I know that good health starts inside the mouth because, like I explained before, your mouth is connected to your gut. It's connected through that airspace. I always call it airspace, to your sinuses, your nose, and your lungs, just by the breath being sucked in. I always say, your mouth is not Vegas, Las Vegas. What happens inside your mouth doesn't stay there. It travels everywhere. So good health starts inside the mouth. So what happens if your gum tissue is bleeding, if it's inflamed, if you have cavities, any symptoms, if you have, a coating on your tooth or on your tongue, what happens then? This might be where good health ends. And this right here is the explanation for why heart disease is on the rise, autoimmune diseases on the rise, all sorts of inflammatory diseases, or infertility is on the rise. If your mouth is not healthy, most of your other organs are being inflicted with some sort of inflammatory process. And this is where good health ends. So it's really important to begin to start to take care of your mouth, and then the rest of your body can also follow. If you're taking care of the rest of your body, but not paying attention to your mouth, you will most likely never fully achieve good health status. Bad breath. I just want to say something here. We have become accustomed. We've been brainwashed into believing that bad breath is normal. We're being sold breath mints and gum and all sorts of things, and, cover your mouth. And even with mask mouth, putting the mask over our face for so long, all of that contributes to the wrong bacteria. The wrong bacteria inside the mouth, as I alluded to earlier, is really what causes bad breath. So it's the signal to you. It's the very first sign that there's a problem. And if you don't do anything about your bad breath, you are going to end up with gum disease, cavities, and then the inflammatory processes that go with that, which then lead to heart disease and Alzheimer's and infertility and diabetes and everything else. So good health starts inside the mouth. That's exactly where it might end. And bad breath is not normal. And even if you wake up with it in the morning, you should not. So it is not normal. We need to change and shift our thinking. But Big Dental doesn't want you to think that way. Toxapaste is what I call toothpaste, alcohol mouthwashes. All of those lead to an imbalance inside your mouth. They lead to the wrong bacteria. They overkill everything. They sterilize your mouth. It's like taking that antibiotic twice a day for life. I'm talking for life, like that antibiotic that you took for 7 days that gave you a stomach ache and diarrhea for 10 days. This is like brushing your teeth with an antibiotic twice a day for life and expecting to not have diarrhea. Except in the mouth, it turns into leaky gum syndrome, which I'll go into in a minute. Even if you're brushing with something that's considered natural or a healthier version, it's still probably not giving you the benefits of what a dental program really should. And I'll teach you what to look for and what to avoid as far as even natural products go. A toothache. So next behind bad breath is sensitive teeth. I know so many people, sensitive teeth and gum recession. Those three things are really the top three problems that adults suffer from. And sensitive teeth is not normal. If you don't change what's happening inside your mouth, those sensitive teeth are going to lead to gum disease as well as cavities, possibly root canals. It's a mineral loss related to the environment inside the mouth. It is not okay. It is not normal. A toothache or mineral loss or sensitive teeth can be reversed. I've seen it and had it done for my clients. They've, 2 to 3 days is all it typically takes. These are people that have had sensitive teeth for years. I've seen this numerous times. I've had sensitive teeth for the past 5 years. No matter what I did, I always had sensitive teeth. I brushed for 3 days. My teeth are no longer sensitive. I can't believe it. So it can be reversed. We just have to shift our thinking and shift the environment inside the mouth. Before I actually go into the dental, we have to understand that our saliva is super, super important. So we want to make sure that we're drinking enough water. We want to make sure that we are salivating the way we should. And if there are any supplements or medications that you're taking that are reducing the amount of saliva that you produce, be aware of that and just make sure that you're staying hydrated on top of that, because your saliva is so, so important in a lot of different ways. So I'll go into 4 functions. There's more, but these are the top 4 related to what I want to go over. Your saliva has antibacterial, antifungal, antimicrobial, antiviral, everything. This is why good health starts inside your mouth. When you're exposed to something, someone sneezes, you drink out of your water bottle that had the open lid and someone had sneezed 3 feet away from you, and then you take a sip of it, that all of that stuff that's on the open water bottle is then in your mouth. And the first place that it should get deactivated or killed is by your saliva. Your saliva has these proteins in it that are going, that will actually kill all sorts of things inside your mouth. Our clients, my customers typically will say that once they've made the switch and they've alkalize their mouth and their saliva is healthy, then they rarely get sick with the common cold, the flu, and anything else that's going around, because their saliva is actually functioning the way it should. So your saliva is protective. That's one of the main reasons you want to make sure that you're hydrated and you do have a good amount of saliva. Saliva also breaks down your food. As humans, we are the only mammals that have enzymes that actually start digestion inside the mouth. That's extremely important for metabolizing your food and being able to extract the nutrients out of it. It also, the third thing is it carries good bacteria from your mouth to your intestines. And I say carries good bacteria, but you have to understand that whatever is inside your mouth, you are swallowing. And that's really gross when you stop to think about it, because you're exposed to everything in the environment. So whatever is inside your mouth, you are swallowing into your stomach, good, bad, or indifferent, good bacteria, bad bacteria, neutral, anything. You are swallowing it. You're inhaling it into your sinuses and into your lungs. So you really want to make sure your saliva is good. And as it's carrying things down into your gut, it's killing the stuff that you don't want. Because guess what? The bad bacteria that loves to harbor inside your mouth and create all the chaos, when you swallow that, you have foul mouth, you're swallowing that bad bacteria all day long. That bacteria loves acids. So where is it going? It's going to your stomach, which creates acid to break down your food. If you have these live things swallowing and you're swallowing them and ending up live in your gut, automatically that's the environment that it loves. It's going to flourish. And then it passes into your small intestine, which is not equipped to get rid of this type of bacteria or virus or whatever it might be, fungus. This is why now we have leaky gut syndrome. This is one of the main reasons we have leaky gut syndrome. So many people have leaky gut syndrome, which is the inflammation of the gut tissue so that the junctions open up. And now things that shouldn't be getting into your body are now entering through your intestines into your bloodstream and then infecting you, causing you to have inflammatory processes. So you would just want to make sure your saliva is carrying good things and bad things, killing the bad stuff on the way down. And the last thing is that your saliva keeps your mouth more alkaline. Saliva is actually fairly neutral. Back in the day when our ancestors were alive, they weren't dealing with as much sugar, processed foods, and things like that. So our saliva was really meant to just neutralize weaker acids, foods that were, might be slightly acidic. They were eating mostly vegetables, mostly fruits, a little bit of meat, when they could hunt and gather it. But mostly the saliva was there to function to neutralize the acids and make the mouth more alkaline. The saliva also contains minerals. That's one of the other components of saliva. Your saliva has the minerals in it to remineralize your teeth. Remineralization of your teeth, you cannot take a supplement for them to remineralize your teeth. It all happens directly inside your mouth through your saliva, through your food, and through the dental products that you're using. So that's why your dental products are extremely important, because if you have leaky gut syndrome or any malabsorption problem going on inside your gut, Crohn's or anything like that, you are most likely not absorbing all of the nutrients from your diet or your supplements. And if you're not absorbing them, this is why pregnant women also end up nutrient deficient. Not only are you might, especially if you're pregnant and you have a digestive issue, you're not absorbing, but now you have, I always call them parasites, but baby is trying to steal all of your nutrients, especially your calcium and phos for their own bone and teeth, which then depletes mom of minerals for her own teeth and bone. So typically moms that are mineral depleted will end up with a cavity after a pregnancy, primarily because their saliva is now mineral depleted. So making sure your saliva is good also starts with making sure your digestive health is good. That all starts with the mouth as well. So this is how mineralization happens. I'll go through it really quickly. So you'll see that acids affect the teeth and cause demineralization. Anytime there's acids inside your mouth, it causes minerals to leave your teeth. I'm talking primarily calcium and phos, but you do have minerals like silica and manganese and magnesium inside your teeth. These are minerals that are in the ion form. So they're not the same type of minerals. So it's important to know that it's an ion form, because not all minerals can be absorbed into your teeth, just in the ionic form. In the ionic form, these types of minerals don't get absorbed by the body. They're not able to be absorbed by the body. So they're absorbed by your teeth. So remineralization happens from saliva, from food, from brushing your teeth in an alkaline environment. The health pyramid, I like to do the health pyramid as related to like the food pyramid. But the health pyramid starts with the gum tissue. These are the tissues that become leaky, which then cause inflammation throughout the body. So at the base of the pyramid, if your gum tissue isn't healthy, then it sort of goes all the way up, and you can expect the fallout to happen internally. Gum tissue is healthy, gut tissue. If the gum tissue isn't healthy, the gut tissue then becomes also inflamed with the wrong bacteria and the stressors that go with that and become leaky. So leaky gum tissue leads to leaky gut tissue, ultimately leading to leaky brain, which means that you're getting inflammatory things or inflammatory responses in proteins and things that shouldn't be entering the blood through the blood-brain barrier, and causing issues. This is why Alzheimer's has been linked to the bacteria inside the mouth as well. So this is just a picture showing leaky gum syndrome, showing that when the gums aren't healthy, food, bacteria, particles that aren't typically able to pass through the tissue can then pass through into the tissue. And since your gums are highly vascular, meaning they have a lot of blood flow through them, that's why they bleed so easily. It can easily enter the bloodstream. And then once in the bloodstream, as I mentioned earlier, travels to the heart because it's in the vascular system going back to the heart, pumped everywhere. And that is why your good health starts inside the mouth, and it's linked to everything. The direct link to heart disease, the bacteria gets into your gum tissue, into your bloodstream, and then directly to your heart. And those tiny vessels in your heart, the ones that, supply the blood to the heart, the oxygenated blood to pump the heart, get clogged very easily. The plaque inside the mouth, they've found to be the exact, not surprisingly, the exact same plaque in your teeth or in the vessels. And the reason being is that bacteria creates plaque. It creates a house. It creates this environment that it can live under. Inside your mouth, that plaque is what the dentist will scrape off your teeth. It's that sticky stuff that then becomes hard if we don't get rid of it in time. Plaque develops very quickly. Bacteria grow very quickly inside the mouth. So you really want to brush twice a day. Some people only brush once a day. Really, it takes like 4 hours for bacteria to start creating plaque. You can mitigate that by eating crunchy foods and brushing or even swishing your mouth vigorously with water. And it's not that hard to do. But brushing twice a day has been most effective at reducing the amount of plaque formed, especially when you're using the right products. Now, when you're not using the right things inside the mouth, creating more acids, of course, acid doesn't break down plaque, and you'll end up with thicker plaque and heavier plaque. But that plaque is the exact same thing. The hardness that you feel, that's what happens inside the heart, or any vessels. Actually, the carotid, any vessels can have plaque growth. So this is just showing it a little bit closer up. The bacteria from the mouth gets into the blood vessels and then creates that plaque, because that's what bacteria likes to do. This is a diagram that shows not all, obviously, but some of the main things that your mouth can be related to, including obesity. It's including, thyroid disease, liver cirrhosis, inflammatory bowel, polycystic ovary, even erectile dysfunction for both men and women. Nitric oxide is produced. One of the key components of producing nitric oxide, which is the vasodilator, it happens inside the mouth. The bacteria in the mouth and the bacteria in the gut mixed with the saliva creates nitric oxide. So if you have anything wrong with any three of those, you are drastically reducing your nitric oxide production. Nitric oxide production is what causes blood vessels to vasodilate or get from small to big. In the heart, that's important because that's what's pumping the blood and the oxygen to your heart to keep it healthy. But as far as erectile dysfunction for both men and women, that reduced blood flow from the nitric oxide being not being there to increase it, reduces, erectile function. And infertility is directly related. Preterm labor directly related to your mouth. I have a story of a woman that was in her 28 to 30 weeks pregnant, went into preterm labor. They could not stop her preterm labor. They ended up putting her, we call it Trendelenburg, on her head. So her head's down here, her legs are up. Put her on a magnesium drip. They wanted to get the baby to a viable age so they could deliver a healthy, or at least a viable baby. And nobody ever thought to look inside her mouth until one day when one doctor came in and said, you know what, let's have a dentist come and look. We have no idea why you're in preterm labor. They found that she had a tooth abscess and started her on antibiotics. And within 2 weeks, her preterm labor stopped. She went home, no labor, went home, and came back and delivered a full-term baby. So it's directly related to all sorts of things, including labor for women. Alzheimer's, atherosclerosis, diabetes, pancreatic cancer, rheumatoid arthritis, those are just other areas. This is just showing that, the bad bacteria inside your mouth, you swallow it, it goes everywhere, all the way down to your stomach. And if you have digestive issues, it's not helping anything. Even if you don't have digestive issues, it's not helping anything. You want to maintain a good microbiome throughout your entire digestive system. Your digestive system runs from your tongue to your tail. I always tell people it's outside your body. You have to think about that as like a tunnel, and that entire track is completely outside your body. And we need to make sure that it's healthy and it's clean, and that bacteria, anything your good bacteria can keep it clean. Those are the scrubbers. They're the things that are keeping your tunnel completely clean. So you want to make sure you have good bacteria, swallow the good bacteria. That good bacteria is going to make sure that nothing gets into the acids in your stomach that can then flourish. And then your good guys in your small intestine and large intestine can take over from there. So I often get asked, why do we brush our teeth? And when I ask this question to people, they're like, oh, to clean my teeth, to clean my mouth, to make sure my mouth is clean. I don't have bacteria. And while you do brush your teeth to clean them, that's not really the correct answer. You could brush your teeth with water and clean your teeth. And you could actually do it better and more safe than using most of the products out there. But the real reason, and this is where the shift needs to happen, if we understand why we really need to brush our teeth for total mouth health, then we'll understand why we need to stop using some of the things we're using and start using the right things. And it'll make a key difference. It'll save you time at the dentist office and the doctor's office. I mean, think about if your dentist prevented heart disease in your mouth. If by changing what you brushed with, you didn't even realize it, but you didn't get heart disease. Think about the money that you save just by making that switch. The dental procedures, they're expensive and they're time consuming and painful. And if you didn't have to go through all that, it's well worth the time and the energy to make sure to make that shift. But you want to alkalize your mouth. The alkalinity is going to support the good microbiome, and it's also going to support a remineralization of your teeth. So you want to make sure that happens. It's going to also, you also want to restore the minerals in your teeth. So that's the one thing that's missing. The minerals would be the remineralizing your teeth, but you also want to detox your mouth. You want to get rid of the gunk that's stuck inside the tissues of your mouth, not just your gums, but your entire mouth, your tongue, your cheek, all of that. Your mouth is exposed to heavy metals all day long, radiation, everything, pollution. And when that gets stuck in your gum tissue, it eventually can make its way into your body through the bloodstream. And it's super easy to detox the tissue, and I'll get to that in a minute. But when your tissue is clean, you have so much cleaner internal tissue as well. This is just showing how interconnected everything is and how your saliva, if you take saliva out of the picture, you increase cavities very easily. Your saliva is going to protect, it's going to kill the microorganisms. So it's going to get rid of the bad stuff. It's going to neutralize the acids. And it's not necessarily going to do anything with the sugar, but the bacteria that feeds off the sugar, you'll just swallow the sugar. So all of these things come into play. If you don't have saliva, or your saliva is not effective, you will end up with cavities and gum disease much more rapidly. This is, I always think this is interesting. This is the acid food chart, which a lot of people don't realize. There's so many things that we're drinking and eating that's acidic. And I'm not saying avoid these things. I'll give you some tips on what to do when you do eat and drink. But, looking at this, your stomach acid is a pH 1. This is why people that vomit, whether because they've got chemo, they're on chemo, or cancer patients, whether they're inducing their own vomit, but, you see their mouth is not good, their teeth don't look good. It's because you're vomiting acid through your mouth and it's covering your teeth, causing demineralization and a wear down of your gum tissue. Lemon juice, this is why putting lemon in your water, I usually suggest just drinking it through a straw if you like lemon juice or lemon water. Just drinking it through a straw, then it bypasses your teeth better. Most juices, but what's really interesting is some dental rinses are acidic by nature, causing cavities and gum disease. So this is when I tell people, like, a lot of the products that we buy, we are actually buying our own cavities and gum disease. This is what we're investing in, our own products that are creating cavities and gum disease. So we just need to get rid of those products out of our practice. Coffee, beer, those are mostly acidic. Red meat, again, is acidic. But looking down further, the higher pHs, that would be as far as food, I'll show you later, but mostly like the green vegetables and things like that. But we want to make sure that we're using dental products that are falling more in that alkaline range. How to heal a cavity and restore your gum tissue. And I get asked all the time, can you heal a cavity? I don't think you can heal a cavity. And I always tell people, if you believe you can heal a broken bone, then you should believe that you can heal a cavity. And the reason being is that your bone tissue is made up of the exact same minerals as your teeth. In fact, your teeth are actually stronger than your bone. Your teeth are stronger than your bone, but break down more easily because of the environment that it's in. Your teeth are exposed to acids all day long, whereas your bone is in a neutral environment with a pH of 7.35 to 7.45. Very neutral. If it needs minerals, it can get them. It's not overly acidic, not overly alkaline. It's very neutral. But inside your mouth, mostly acidic. So if we change the environment inside your mouth, we can definitely heal a cavity just like you can heal the bone. My formula for a cavity. So bad bacteria, the bacteria that causes cavities, sugar or carbohydrates, the bacteria feeds off sugar and carbohydrates, causing lactic acid, which then causes a breakdown or demineralization. That's when minerals leave the tooth. But when you look at this formula, there are two things that we can actually control. You'll never completely get rid of the sugar in your diet. So I don't ask that you go completely sugar-free because it's almost impossible. But we can get rid of the bad bacteria and cut down on the amount of acid in our mouth by changing the diet that we're eating, as well as changing the products that we're using. So the formula for a healthy mouth is just the reverse. The good bacteria is not going to be affected by the sugar and the carbohydrates because it's not going to feed off of that. And it's going to create more of an alkaline environment, which is then going to cause remineralization, or the minerals from your food, from your saliva, or from your dental products, if they're in there, to go back into your teeth. Just a quick overview of the tooth. The enamel is the outer part. It's the hardest part. It's the thickest part, and it's the whitest part. If you're starting to see teeth that look almost see-through, transparent, and you have a bluish grayish or a yellowish tinge to it, you're starting to see the dentin. And the dentin is this area right beneath the enamel that is made up of minerals, but it has a little bit of fluid. I'd say it's almost like a sponge. It's kind of fluid filled. It's got proteins in there. It's got some antimicrobial things in there to help protect the pulp underneath it, which has your blood vessels and your nerves in it. So you don't want any bacteria getting down and infecting this part of your tooth, the pulp. The main thing to understand is that as the enamel's wearing away, and you start to see the dentin, or that see-through appearance, most people then reach for peroxide. I'm going to give you a little secret of how peroxide actually works to whiten the teeth. The dentin is, like I said, fluid filled. It's like a sponge. I call it your shock absorber. Every bite that you take, if you didn't have the fluid filled section, your shock absorber, you would probably feel it in your pulp, which has the nerves. So your dentin is supposed to kind of be like a shock absorber, so you don't feel everything. What happens with peroxide is peroxide pulls the fluid out of the dentin. I say it dehydrates the dentin. It does that because if you take the fluid out, it makes the tooth look more, it makes that area, the dentin, more opaque, more see-through, so the teeth look whiter. Unfortunately, you've just destroyed the infrastructure of your tooth. You've just removed the fluid, and now you've weakened the internal structures of your tooth. This is why peroxide hurts, when people do peroxide treatments and they get that sensitive feeling. That's why, because peroxide gets down into the dentin and then ultimately affects the nerves and the blood vessels. So, and there's better alternatives out there. If you want a whiter tooth, the best way to whiten your teeth long-term is to rebuild the enamel, remineralize the teeth, thicken up that enamel so that you don't get that see-through appearance, and it can be done. And this is showing just mineral loss. When you lose minerals all in one area, it's more like a cavity. When it goes deeper, it becomes more of a cavity type of defect. When you lose minerals all over the surface, and these can both be happening at the same time, they can be happening in different, different teeth at the same time. But when you lose minerals all over the surface, that's usually more of like a sensitivity. You start to feel a sensitive tooth, but you still definitely feel sensitivity when you end up with a cavity. That's obvious. But sometimes the sensitivity isn't definitely like a divot in the tooth. Sometimes it's overall the surface of the tooth. And then the gum tissue. The gum tissue is extremely important. Like I talked about, it's important. It needs to be up against the teeth. You don't really want to get the pockets of the between. That's where bacteria can get caught, and that's where bacteria likes to hide and grow. So we talked a little bit about Toxapaste and mouthwash and things to, these things I can go into it if you want during questions, if anybody has questions, what to avoid. Pretty much, anything that is bought off a shelf at a regular store is probably not going to be good for you. Toxapaste includes anything, even natural products that contain glycerin. Glycerin's a very common ingredient in toothpaste, especially natural ones. It makes it super slippery. It makes it feel really good inside your mouth and leaves your teeth feeling super smooth. Unfortunately, what glycerin does is it leaves a coating on your tooth. I call it like a saran wrap coating or a Band-Aid. And what happens is that minerals from your food or your saliva cannot get past that glycerin coating and can't get into your teeth. So you end up with a tooth that might have been sensitive or has mineral loss that you can't remineralize because of glycerin. It takes a little while to wear the glycerin off. And a lot of times by the time you wear it off, you're brushing your teeth again. So you're just putting that glycerin coating back over the teeth. Mouthwash, anything with alcohol in it, anything with triclosan, and triclosan can be found in toothpaste as well. Sodium lauryl sulfate's usually not good because it just kills all the good bacteria as well as the bad bacteria. It's a surfactant. I'm trying to think offhand of anything else. Fluoride, of course, is a no-no. It's a neurotoxin. It's not needed. Fluoride is a mineral. It's a heavy metal that is not normally found in your body. The only way you were born with fluoride in your body was if your mother had fluoride in her body. Otherwise, as a human, you should not have been born with fluoride in your body. It's not normal. Why would you want to put fluoride? What happens with the fluoride is the thought behind it was going to strengthen the teeth, but in reality, what it does is it displaces like a calcium and takes over where the calcium was. And the calcium is going to be a stronger calcium, phosphorus, your own minerals that are supposed to be in your teeth are going to be a stronger functioning tooth than fluoride. In fact, a couple years after they did the fluoride research that they came out and said, oh, fluoride's amazing, it's going to strengthen your teeth. They actually had, the research actually showed the opposite, that fluoride did not do anything to strengthen the teeth. It was actually not doing anything, but they buried that research so nobody would see it. So let's go back to why we brush our teeth and what should we look for. You want to brush your teeth to alkali, so you want something that's going to be alkaline. The main ingredient to look for is baking soda. You want a food grade type of product. It's going in your mouth. You are going to consume some of it. Studies have shown that everyone consumes their toothpaste, especially children, but even adults. And they have proven, there's studies that have shown that the triclosan, the tiny amount of triclosan that you might have swallowed from your toothpaste, causes gut dysbiosis, which is the bacteria imbalance. So if you're brushing with triclosan, you're brushing with that antibiotic twice a day for life and expecting to not get diarrhea of the mouth or the gut. Not going to happen. Baking soda is what I use. It's the best indicator. It's a great food grade ingredient. We bake with it, very safe. And it's alkaline. So that's what I tell people to look for. You want to restore your microbiome inside your mouth. You want to remineralize. So you want to look for something that's going to have minerals. I use hydroxyapatite. It's a brand new or a fairly new ingredient. Hydroxyapatite is calcium and phos. It's the exact identical minerals that are in your teeth. So it just makes sense to brush with it, right? I also use clay. I'll show you in a minute. I use a blend of 3 clays. Clays are amazing because they have all of the minerals, not just the calcium and phos, but they have the manganese and the silica and the magnesium and everything else, where calcium and phos are only the 2 ingredients in hydroxyapatite. So if you're brushing with something that just has hydroxyapatite and no clay in it, while you're going to be effective, as long as it has baking soda in it or something that's alkaline, you will be more effective than brushing with other things, but you're still going to not be putting in all of the minerals. And it's a lock and key. You can't, if you lose a manganese mineral out of a tooth, you cannot replace it with the calcium. It has to be replaced by manganese, and it has to be alkaline at that moment. So that's why it's important to look for something that has clay in it. And then you also want to detox your mouth. So detoxing your mouth, clay is another thing. So I always tell people, look for hydroxyapatite, clay, and baking soda. Those are the 3 main components, not glycerin. If glycerin's a part of that, forget it, not a good thing. Glycerin's going to block all of that. Clay, I love clay. This is what clay does. So I use a blend of 3 clays, but they pull toxins out of your gums. Clay binds, it's an ionic bond. And if you know anything about chemistry, if you remember your chemistry classes, and when an ionic bond forms, it is very hard to break it. This is why clay detoxes are so, like so many people do them. They'll ingest clay. I like to ingest bentonite clay. I do it usually the 1st, 2nd, and 3rd of every month. At night when I go to bed, food grade bentonite clay, a teaspoon in water, stir it, drink it, go to bed. When you're sleeping and it's washing through, it's going to bind to a toxin. As soon as clay binds, it does not let go, and you get rid of it when you go to the bathroom. Same thing with your gums. You're brushing for 2 minutes. As you're brushing, it's binding to toxins. You spit it out. Even if you swallow it, it's going to bind to these toxins all the way through. Any clay that you would swallow that wasn't would just clean you out as it goes out. So that's why clay, as long as it's a food grade, I use food grade clay in my products. Most dental products don't use food grade clay when they're using clay. Second, it removes stains off the teeth. So it's going to actually whiten and cleanse the teeth as well. It neutralizes acids because clay is actually slightly alkaline. Adding baking soda to it actually makes it more alkaline, and then it can be more effective against all the acids inside the mouth. And then it also puts the minerals back in the teeth because it's mineral rich. The blend of 3 clays that I use, bentonite, white kaolin, and French green. Bentonite, and you'll see bentonite, that's the most common clay in tooth powders and toothpaste. Bentonite's great, not all inclusive. So I blend it with kaolin, which has some of the minerals that bentonite doesn't. French green is because I'm a nurse anesthetist, and I know that if I can reduce pain and inflammation in my patients, I can speed healing. That's been proven. Reduce pain, reduce inflammation, healing happens so much faster. Same thing inside the mouth. French green is anti-inflammatory, and it's analgesic by nature. So if you're having any issues inside your mouth, it's a great medium to brush with. French green clay is from the French sea. So it's green because it has plant breakdown. It has phytonutrients from algae and other plants. So when you think about all of those, like algae, how many nutrients and vitamins are in algae, as you're brushing those into your gum tissue. Mouthwash. I'll dive into mouthwash for a second. Mouthwash is typically, I tell people avoid mouthwash unless you know exactly what you're looking at, because most mouthwashes do more harm than good. Most mouthwashes, including some natural mouthwashes, are destroying all your good bacteria inside your mouth. So you really don't need a mouthwash. If you're brushing with the right thing, the best thing that you can follow it up with is a serum, which would be an oil-based serum. Oil is what passes through and carries things through into the tissue. We call it lipid soluble. Things have to be lipid soluble, not water soluble. Most mouthwashes are made with water as a base and alcohol. Nothing is going to actually cleanse the tissues of your gums. It's actually just going to super clean, overkill your mouth. It's going to sterilize it. Think about cleaning and sterilizing an OR room. You're getting rid of all the germs. Well, that's what mouthwash does. What you really want is something that's going to penetrate and nourish the tissues of the gum. If you want to grow back your gums, if you want to establish healthy gums, you want to nourish it. So olive oil is what I use in my gum serum. It's a base. Many people do oil pulling. Oil pulling, I always get asked, what do you think about oil pulling? And I always like to tell them that, the reasons that people oil pull, and most people use coconut oil because it tastes the best out of all the oils. You have to swish coconut oil, olive oil, castor oil. Those are usually the oils that are used. You put a scoop in your mouth and you have to vigorously swish it for 20 minutes. People cut it short. They don't do it all. That pain point is I got to do it for 20 minutes. I have to swish vigorously. So you have to pay attention. And it's just, it's not conducive to most people doing it for 20 minutes and correctly. Although it works great, it helps to cleanse the tissues, helps to whiten the teeth, support healthy microbiome. At the end, you spit it in the garbage can and it's gone. But what's interesting is if you change what you're brushing with to a clay-based toothpaste or tooth powder, clay detoxes. Remember when I talked about detoxing? Clay detoxes very quickly. And so in a 2-minute brush, you are effectively going to do what oil pulling does in 20 minutes. You just brush, you're good. So not saying don't oil pull. If you love it, do it. It's still great. But if it's a pain point and you want the same effectiveness in a 2-minute brush, changing what you brush with will do the exact same thing. My gum serum is an olive oil base. Olive oil is actually the best medium to use for cleansing your tissues of your mouth. The reason people don't use it to do the 20 minutes is because it just doesn't taste good. If you've ever swallowed olive oil, I've done a liver gallbladder cleanse where you drink like a cup of olive oil. It's horrible. Like on pasta, it tastes great with seasoning, but by itself, it's not good. So my gum serum has olive oil because it's nourishing. It helps support the tissues of the mouth. It helps support the collagen. Collagen is extremely important when you talk about bone health, the bone, your jaw bones, but it's also important for gum tissue health. It also has nutrients that's going to increase blood flow and support the microbiome. But I blend it with 11 different essential oils. The essential oils are imperative because they help reduce inflammation. They help increase healing, increase blood flow, support the microbiome, penetrate the tissues so that they can actually get into the pockets of the gum or get into where the bacteria or everything might be hiding, helps fight gum disease, prevents tooth decay, and then ultimately will help ward off any bad breath that's going to freshen your breath. And then this is the light therapy that we mentioned. I really wanted to create something that was going to help the mouth heal or stay healthy if you're someone who has a healthy mouth. I also wanted something that was going to be able to whiten the teeth, but whiten it differently. When I mentioned peroxide and how it destroys the internal infrastructure of the tooth to whiten it, I wanted to do something that would actually help whiten the tooth by remineralizing the tooth, making that enamel thicker and thicker and thicker. But I also wanted to address the bacteria inside the mouth, and I wanted to address the gum tissue. So I developed a teeth whitening system that does more than just whiten your teeth because it uses both the red and blue LED lights. So using the system, you can use, it has 16 red lights, 16 blue lights, and you can use them independently, all red, all blue, or you can use them together and have 32 lights. The red light therapy supports health. I usually tell people the red goes with your gum tissue red. So red. If you have issues with your gums, receding, bleeding, sensitivity, anything, red light therapy is what I would suggest you do. Use the red light only. It's a 15-minute treatment. You can use it every single day. You can use it with the gum serum. You can use it with my gel, but it's important to use the red light. It's going to reduce the inflammation. It's going to increase blood flow, and it's going to increase collagen. This is the device that helped somebody heal their gum tissue within 3 months on their path to no longer needing any kind of gum transplant or what for gum therapy. The blue light supports bacteria. I always say B and B, blue light bacteria. If you have a bacteria problem, if you have cavities or sensitive teeth, if you have gum issues because of bacteria, the blue light is what's going to help support that. What's interesting about blue light, Harvard did a study, and what they exposed the bacteria that causes cavities. There's a bunch of different ones, but they all have this black, like a mitochondrial black portion to it. And what they discovered is when this black piece of bacteria is exposed to blue light, it essentially erupts. It actually makes that black mitochondria piece explode. When that happens, the bacteria is dead. So in essence, blue light at a certain nanometer, which is what ours is set at, kills bacteria that causes cavities. So imagine putting this inside your mouth. Blue light, just like red light, penetrates into the tissues, can get between the teeth or into the pockets to help get bacteria that you can't get when you're brushing or you can't get when you're flossing. So it's going to penetrate the tissue, kill the bacteria, and freshen your breath. So I tell people, when you have a bacteria problem, do only the blue light. If you have a bacteria and a gum tissue problem, alternate. Or you can do both treatments independently. So you can stack them and do a red in the morning, a blue at night, or you can do them back to back if you want. But I usually say do the single light. Or you can alternate days. If you just want to do one treatment a day, do one red one day, blue the next, red, then blue. What's the time to do them when the 32 lights, the blue and the red at the same time, is typically when you don't have any issues, when your mouth is super healthy. You're going to get the effects of both, but because you're getting both, you're going to get a little bit less of the high potency red, high potency blue. So when your mouth is healthy, if you don't have any issues going on at all, that's when I say do the red and blue light. And then ultimately it's going to help whiten the teeth, because the bacteria that causes cavities and gum disease is yellow. It's kind of like a yellowish color. When you see it, plaque is like a yellowish color. If it's killing this bacteria, it's going to kill that bluish or that yellowish color. And it's going to actually whiten your teeth that way. But it's also connected to using the gels. My gels that I created are peroxide free. I made them with olive oil as the base. So for the same reasons, nutrients, it's alkaline. It's going to help with the gum tissue. Made with hydroxyapatite. If you're going to have this gel on your teeth for 15 minutes, think of how much calcium and phos can go back into those teeth and remineralize, build that enamel to make them whiter. Has 2 different clays for the exact same reason. These are all alkaline. And then it has the essential oils that are going to help with the bacteria, going to help increase blood flow, and all of the other things that are really good. This is not going to hurt. So doesn't have peroxide. There's nothing in this that's going to cause your teeth to hurt or be sensitive while you're using this. In fact, the opposite is true. This is what my products look like for anybody that's interested. I did create a kit. It's called the Detox Kit of my dental products. It's a 60-day supply. This is like, people kept asking me, where do I start? What do we use? So I put this together. You get a morning and nighttime tooth powder. The powder is different, of course, than using paste if you've never used powder. It's more concentrated, which is why I like it to start. I do make a paste, and you can convert to paste after your 60 days if you want. I'll tell you the honest truth is that most people, once they switch to powder, they never go back to paste. The powder is paste without the water. So when you think about extracting the water, you're left with all the good ingredients. My paste is made with colloidal silver. So the colloidal silver makes it a little bit more of an active. It's going to help get rid of the bacteria and reset the mouth. But typically toothpaste is made with just regular tap water, crap water, loaded with those heavy metals you're trying to get rid of. So using a powder is going to help detox your mouth. And then you get a morning and nighttime, you get a copper tongue scraper. We didn't even talk about that, or I didn't go into that, but scraping your tongue helps to remove that bacteria coating on your tongue. And scraping takes about 10 seconds, not even, twice a day. So scraping your tongue, copper tongue scraper will last you a lifetime if you take care of it. You get a little bottle of my gum serum that'll last about 2 months as well. You can take that with you. You can use it during the day, but that's 1 or 2 drops on your finger, 3 if you want, and then just swipe it all over your gums and then around the tissues of your mouth. And the floss picks that I make are biodegradable. They're made from cornstarch. The entire pick biodegrades, and then the floss is bamboo infused with charcoal. And then the toothbrush is a bamboo toothbrush, biodegradable bamboo toothbrush, as well as a detoxing deodorant, because most people that I've talked to have tried numerous deodorants, wasted so much money that, that's the biggest pain point. I've wasted so much money on deodorants that mine is developed by a nurse, as a nurse who wants to deep cleanse your tissues. So it's created completely different. So I gift you one for free with this kit so that you don't have to waste any money. If it works, great. If it doesn't, you didn't waste any money. And then the teeth whitening system is pictured there as well. Let me just really quick, and then I should have time for questions. Tips for a healthy mouth. My kids always come back to tell me the first one: eat your dessert first. They're like, we go to dinner and they're like, Mom, I want to order dessert. You always say eat it first. And the reason I say eat your dessert first is because it's usually loaded with sugar. And if you're going to eat sugar, eat it at the beginning of the meal, because then at least you can wash it off your teeth and you're not going to feed the bacteria as much. It's going to go feed the bacteria in your gut, but at least your mouth can stay as healthy as possible. So eat your dessert first. Eat your greens last. Eat your crunchy food or greens last as you're eating it. Even if you just save one bite, eat your steak, eat your potatoes, eat whatever, save one bite of your vegetables, because that, just eating that at the end is going to help get rid of the rest of the food in your mouth and swallow it down so that it's not there lasting. Eat crunchy snacks like your carrots and celery and broccoli and things like that. Crunchy snacks, that's going to help clean your teeth throughout the day. Swish with water after meals, snacks, and even coffee or tea. Just a brisk swish. Grab your water when you're done eating. Swish it really good between your teeth. That's going to help cut down on the amount of food that stays inside your mouth and get rid of like that excess sugar or anything. I always say finger brush. I've got the little size that comes in the kit of my Dirty Mouth tooth powder. And I tell people, dip your finger and just finger brush that right on your teeth. You can, let it wear away and swallow it because it's all food grade. And I do that. And that's what I use to freshen my mouth. And, you're remineralizing your teeth and you're getting rid of that acid. So that's the important part. And then freshen your breath throughout the day. The gum serum is great to do that. Just a little drop, and then you can drop it on your tongue, kind of put it in some water. You can also drop it in water and swish it around in your mouth, or just right on your gum tissue. I just want to go over the alkaline foods. These are the things you want to end with. Keep some of it towards the end of your meals, but the highly alkaline, of course, is your broccoli and your cucumbers and green drinks, kale, kelp, spinach, and parsley. Those are the main ones that you'd want to end with if those are your choices, but any of these are great. Any of these are great. And, obviously it's mostly your vegetables. I just wanted to put this in here. I thought this was extremely interesting, especially when you guys are all gluten-free, which I am as well. Consuming gluten, this is what the general public doesn't quite understand. Consuming gluten blocks the absorption of certain essential vitamins and minerals. One of them is vitamin D, which is extremely important for the development and strength of your tooth enamel. So if you're not able to absorb vitamin D from your food. This is where I'm talking about, even if you don't have digestive issues and you're eating gluten, you're not even absorbing your nutrients because gluten is blocking them. And then you become deficient internally, and then your saliva becomes deficient, as well as all the other organs become deficient because gluten is actually blocking the absorption of minerals and vitamins. So there you have it. The orgasm, the fresh feeling inside your mouth when your bacteria is healthy. So who's ready to start having orgasms? And that's just me and my family again, keeping you healthy as your natural nurse.
That was great. I'm ready to have some more orgasms myself.
Twice a day, morning and night.
Morning and night. No, I love that. There's a lot there that you covered, and we've got several questions that have come in, and so I'm just going to dive into them.
Good, perfect.
If you're open to answering some of these questions, and I'm not. So here we go. Well, Elizabeth says, "Good evening. Love Trina. Her products are the best things that I've used for many years. I recommend her dental products highly." So thank you, Elizabeth, for sharing that. Okay, so let's see here. What is the impact of using fluoride products? I don't know. This is a weird question. I don't know if it's an English issue, but Emmanuel wants to know, what's the impact of using fluoride products like tooth? Maybe he means on the teeth. You kind of touched a little bit on that. Do you have any more to say in more in depth?
So fluoride is a neurotoxin, and it really has no place in the body. As soon as we started fluorinating water and fluorinating our toothpaste, the problem is, as soon as fluoride becomes too prevalent, like your body is going to start absorbing it, and it's going to absorb it and take it other places. And fluoride is not really strengthening the teeth. So it really has no place in the body at all. As soon as it gets into your dentin, now you're exposing your nerves. It's a neurotoxin. You're exposing your nerves and your blood vessels. As soon as it gets into your blood vessels, it travels. They have found fluoride in bone. When fluoride gets into your pineal gland, it can cause major issues, calcification and things like that. So fluoride there is no place for it in your body. It shouldn't be in your body. You weren't really meant to be born with it. And it has no place. It really has no place. And as soon as it becomes a buildup, don't forget your gum tissue, as soon as, if you have any bleeding and you're brushing with something that's fluoride based, you're just exposing your entire body as it's absorbing into your bloodstream. And that's not healthy, especially long-term. Doing it every once in a while. If I usually tell people, here's the tip. If you run out of, I've had people that have traveled and they forgot to take their dirty mouth tooth powder with them. And so they've, gone to the store, and for the first time in a long time, they bought toothpaste that foams. And they were like, I will never buy toothpaste that foams ever again. I can't believe I could ever brush my teeth with it. They're like, I gagged. So I tell people, if you ever go travel or go somewhere or run out of your dirty mouth tooth powder or paste, the best thing to do is call down. Most hotels have a kitchen, or go and buy some baking soda. Baking soda is effective for brushing your teeth short term. Baking soda and charcoal. I didn't touch on charcoal either. I do use charcoal in some of my formulas. Charcoal and baking soda are effective at brushing your teeth, but not long term. The main reason is both of them are alkaline. And both of them will not destroy your good bacteria. So if you run out of something, both of them are effectively going to clean your teeth, help cleanse your tissues, but they are not going to remineralize your teeth. There's no minerals in either one of them. So brushing with charcoal alone or baking soda alone, I know a lot of people just brush with baking soda. You're not going to be replacing those minerals. You're going to end up with sensitive teeth and cavities and not replacing those minerals. So as a short-term fix, and I'm talking like a couple days, you're not going to do any harm. You're actually going to do better than going and grabbing something that's toxic and going to destroy all your bacteria, your good bacteria, because both of those are going to help keep your good bacteria in place and not kill your good bacteria. So that's a little tip.
Awesome. Another question. Alkaline, I'm sorry. How acidic is seltzer water? Somebody's asking, I guess, is it safe to drink seltzer water on a regular basis, in your opinion?
I don't know what the pH of seltzer water is. I could probably Google it, but what I would say is if you Google it and it says that it's acidic, most of the time I suggest drinking, if you can, drink it through a straw. Or when you're done drinking it, swish with water. Here's the key. Here's the thing. If your mouth is healthy and your teeth are healthy, or you get to the point where they're healthy and you don't have any issues going on, you're not sensitive, you have great dental checkups, your gums are healthy, drinking a seltzer water or even lemon water or coffee normally, isn't going to do any harm to you. It's the extreme. It's having a mouthful of bacteria that's harmful, creating acids, and then putting more acid on top of it. So that's basically the problem. But if you can get yourself to a healthy mouth, healthy teeth, healthy gums, doing those things isn't going to be harmful. That's why I don't take sugar out of the equation, because you can't. So you still have to be able to live. But if you can get your mouth healthy, sugar inside your mouth isn't really going to cause a problem. It's going to cause a problem internally. It's not good for your body and it's not good for your brain, but it's not going to destroy the health inside your mouth, of course, unless you overdo it. Then it will feed the bad bacteria inside there.
Okay. Next question. Does drinking hot beverage with cold food crack the teeth? Because they're asking about that transfer of temperature, right?
No, it shouldn't. What would crack the teeth is, if your enamel's really thin. I mean, I guess it's always a possibility, but I don't think it would happen on a regular basis, especially if you have a healthy enamel. Your enamel is really thin, really thick. In fact, like I said, it's stronger than bone. It's supposed to be stronger than bone. So it really should withstand a lot of stuff. If you're cracking teeth, you have a demineralization problem. You have an acid problem, a demineralization problem. And so drinking hot water and cold food, or vice versa, isn't the problem. It's the fact that you have a structure problem related to your enamel.
Next question from Melanie. Does high blood sugar cause cavities when a person is not eating high carbohydrates or high sugar in their diet? So like if they have a blood sugar problem that's not being controlled, even though they're not eating excessive carbs, is that something that also is going to contribute to cavities?
It will ultimately, because it's a two-way street. So poor oral health can lead to diabetes. It can cause diabetes, like I mentioned. Diabetes can cause bad oral health for the same reason, because the pH of your saliva won't be as alkaline, and the contents inside your saliva won't be as mineral rich. You won't have as effective enzymes to break down your food, the antibacterial properties. So it's a two-way street. They always say, what came first, the chicken or the egg? Was it the bad mouth, or, the bad oral health, or was it the diabetes or the heart disease? And of course, you never know. It is a two-way street, but they feed off of each other. They definitely feed off of each other.
Morgiana wants to know if you recommend water picks.
Oh, I do like water picks, but they do not replace flossing. And I usually, with my gum serum, I usually put 2 or 3 drops inside there, and it is oil, so it's not going to completely blend, but you do get a lot of and flossing or doing the water pick with the gum serum. When you shoot it between your teeth, that actually feels really, really good. But I do like water picks. I usually tell you water pick first. I have a whole system. If you get my dental detox kit, you get the whole program. I usually say brush first in the morning. So you'll brush and then floss, and at night you'll floss, then brush. So it's opposite. I usually say breakfast, BF, brush first. And then at night you want to floss first, but I would water pick before both of those. Do the water pick first, and then brush and then floss in the morning, and then water pick, floss, brush at night.
Okay. Question from Gene. I heard that coconut oil pulling kills the good bacteria too. Do you have thoughts on that?
Coconut's pretty safe. It may kill some, but I don't really think it does. I haven't heard that myself. Coconut oil is pretty neutral and is pretty protective of your microbiome.
Let's see here. Next question. A lot of comments. Somebody was asking earlier if they have just horrible dental health and it's, and they can't reverse the years of damage to completion. Do you recommend those individuals look for dentures or implants? Is there something that you recommend in somebody who's already got, pretty widespread destruction in the mouth?
Yeah, I usually say go see a biological dentist. They're going to give you the best answer. I can't, everybody's different and your situation is going to be different from everybody's. I would say see a biological dentist. They're worth the time, even if you have to drive. I actually I'm in Ohio and I fly to Scottsdale for my biological dentist. And it's well worth it. They're more in tune to, and they'll take into consideration a lot more than just you need dentures or you need something. They take, consideration into your bone structure, into your lifestyle, all sorts of things. So I would say that, but overall, I would still say your gum tissue still needs to be addressed. It still needs to, no matter which route you go, you still need to address gum tissue. And the red light therapy would benefit you so much for either one of those, even if it's dentures. I have a lot of people that are like, I can't buy that. I don't have teeth. And I'm like, you still need the red light. Like you still need the stimulation to the gums. You still need, there's still bacteria inside your mouth. The light therapy is really helpful and beneficial. It's really great too after dental procedures, just to pop that in. I had a dental procedure not too long ago and I used it and it helps so much to heal.
What are your thoughts on mouth taping? I've been doing it and I no longer wake up with my mouth open and desperately needing water.
Mouth taping's great. Yeah, I've mouth taped in the past. I don't do it every night, but I have mouth tape. Mouth tape is nice because, and there's different ways that you can do it. There's some that go all the way around the mouth. There's some, they help you breathe through your nose, which is the way you're supposed to breathe. And it helps you so that your lips are closed, but your jaw is open. And what that does, if people don't understand this, when you're clenching, when your teeth are closed and you're clenching, your body is in sympathetic, so fight or flight system. And that system doesn't allow healing. It doesn't allow for your body to relax and heal. And many people at night, they clench their teeth. And so you're sleeping in a sympathetic state. You're sleeping in a fight or flight state. And you wake up wondering why you feel like you just chased lions through the woods. And it's really because all night you're clenching. So sometimes what happens for people when they tape their mouth is their jaw actually relaxes and their teeth separate. And that puts you in a parasympathetic or the rest and relax state where your body can actually repair. So I really like it for that. And then of course, mouth breathing is not good for the bacteria inside the mouth for the same, like you end up with a dehydrated mouth. Wearing a face mask for the same exact reason. The number of months that we were all forced to wear face masks completely destroyed oral health. Many people that never had a problem with cavities or gum disease showed up in their dentist office with cavity and gum disease. And it's mainly because of the same situation. You're rebreathing this air that through your mouth. Many people were mouth breathing and you're dehydrating your mouth. Even if you weren't mouth breathing through your nose, you're becoming more dehydrated and you're not drinking as much. And then your saliva falters and the bad bacteria just goes wild because of the acid of the rebreathing. So it's the same situation. But yes, I do love, because you are nose breathing and you're going to be humidifying. Your nose is made to humidify the air, to capture anything because of the little hairs in your nose, capture anything so you don't breathe it in. And it's just a better way to relax your entire airway when you're sleeping.
Angeline wants to know, is it dangerous to go for teeth cleaning on a regular basis?
I don't think it's dangerous. No. I mean, it just depends. I think it's more dangerous if you're not using the right products, because you're just, you know, you're going to be hurting your gum tissue and your teeth. You know, a lot of my clients end up just going once a year. To be honest with you, I spoke at Paleo FX a couple years, and 1 year after I talked, I had a biological dentist come up to me, and he said, you know, he just loved my talk. He loved the way, you know, I was teaching this. And he said, you know, back in the day, it was, you know, once a year for a cleaning was the recommendation. And the ADA, and I don't know when this happened, it was around the time that they put sugar in toothpaste, but he said the ADA wanted to increase the amount of time people need to see the dentist. They wanted to give their dentists more, patience and more money and more whatever. So they wanted people to now come twice every 6 months instead of yearly. And so what they did is they put sugar in toothpaste so that people would have a reason. They would need to come because they were having sensitive teeth, cavity, bacteria, gum problems. So they put sugar in toothpaste to make it so that people had to see their dentist every 6 months. I usually tell people, you do what you want to do. You know, if you're doing good every year, you know, your gums are good, you're healthy, yearly should be sufficient, you know. But if you feel better going twice a year, if you're having issues and your dentist want to see you every 3 months, that's great. But I think it's better to look at what you're using and maybe change a few things there. If you're going because you're having issues, I'd still look at what you're using, because if you're having issues, that can be fixed, that can be changed. Your mouth, you're not stuck with the mouth you have. That's the important thing. Your mouth is, it's a living thing, it's viable, and it can change. Your teeth are not dead, they are alive, and they can lose minerals and they can take minerals in. Same thing with your gums. Your gums are epithelial cells. I get told all the time, you know, you can't regrow gum tissue. I'm like, really? People told me you can't heal cavities. I've healed numerous cavities. I had a customer once email me. It was a Saturday night. I'll never forget it. This was years ago. I was doing emails. This is way back when I didn't really have a staff because I was so new, but and I was a Saturday night. It was like 10 o'clock at night. I was exhausted. I thought, I'll listen to one more voice message. And it was this woman from Texas, Miss Gibbs. I'll never forget her. And she said, I don't know what you people are doing over there. And I'm thinking, oh no, this is not the one I wanted to listen to. I don't need a problem at 10 o'clock at night. She goes, but you are the bomb. And I'm like, what? She said she went to her dentist and she had 6 cavities. One of the teeth needed a root canal. So she bought my Dirty Mouth tooth powder as a last resort, hoping that she can save any of her other teeth. And she had been using it for a couple weeks, and she went to the dentist. She was driving home from the dentist, and she went to her appointment to get her root canal, sat down in the chair, and he said, Miss Gibbs, you can go home. You only have 1 cavity, and it's small enough that it doesn't need a filling, let alone a root canal. So she drove home praising me because she was so excited that all of her teeth had been healed, and the one that needed a root canal, she didn't even need a root canal. So you're not stuck with the teeth that you have. You're not stuck with the gums that you have. You're not even stuck with the body that you have. Things can be changed. You just have to make some shifts. And sometimes it seems more expensive when you make those changes. I know natural, you know, healthy food is more expensive than, you know, contaminated pesticide filled food. Same thing with dental products, but the long-term effects of that is going to be a lot better for you, not just your health, but you're going to spend less. You're going to have less procedures and less issues. And those are things you'll never know you missed out on. Like I said, if you never get heart disease, but yet if you kept doing what you were doing and ended up, you never know that you missed out on heart disease. And what a great thing to miss out on.
Well, absolutely. And I think, to me, what a great thing to miss out on as well would just be the litany of dental work, that you see in the 50 plus age group, where they're running in for implants and they're running in for bridges, and all that stuff breaks down. None of that mechanical stuff that's used is better than your own teeth. So anything you can do to preserve what you have, to me, only makes sense. And I love what you said earlier about the teeth. I mean, you're not stuck with them. They're dynamic. They grow, they heal, they repair, they have a blood supply, just like any other tissue. If you get a cut on your skin, your body knows how to heal it, but it can't heal if every time it tries to form a scab, you tear it off or irritate it. And I think so many people do that, as you've so eloquently pointed out, by using the wrong products and then eating the wrong diet.
And what I really want to do, and I want people to understand, is with your saliva, it's the secretion that protects you 24/7 when you're not brushing your teeth. So we all think that, oh, I take care of myself because I'm brushing my teeth. But if you're destroying your mouth for 24 hours a day, eating, sugar food, eating gluten, eating, and even if you're not doing this, but you're brushing with something that's creating acid inside your mouth, your saliva cannot protect you 24. This is the real root cause of cavities and gum disease. This is what the ADA does not want you to know. They don't want you to know that if you make your mouth healthy and use products that support your saliva, you won't get cavities or gum disease. Chances are really good you won't, because of the fact that your saliva is protective, and your saliva is going to neutralize things. It's going to protect you from bacteria, and it's also going to remineralize your teeth. There was from a dentist that I follow online, said there's no such thing as genetically having bad teeth. It's just not true, because if you do everything and create wellness, then there's no such thing as I'm genetically prone to cavities. It's not true. It's just not true. You just have to make a switch. And it might be a lifestyle switch. It might be changing what you're eating, changing what you're drinking, not indulging too much, cutting back, changing what you're brushing with, and maybe brushing twice a day instead of once a day, or 3 times a day instead of twice a day, adding like a red light therapy or a blue light therapy to your mouth. It just might be adjusting some of those things, but there's no such thing as I'm prone to things anymore. We have to start taking responsibility and ownership of some of this stuff and figuring out, how do I go about getting my body back to normal? Because that's what my goal is through my entire product line. My goal is to let your body function naturally, because if your body is functioning naturally, like you said, your body is designed to protect you. Your body is designed to heal. Your body is designed to detox and get rid of the stuff you don't need or want. And if we blind it, like gluten blocks the absorption of nutrients. If we continue to sabotage ourselves, your body can no longer do it. And that's when we fall into problems. And then we start looking for other solutions, other things. It's like the drugs, the drug companies. When you go to the doctor for one thing, now all of a sudden you've got a list of drugs and you keep going back because you keep getting more symptoms. And it's the same type of thing. But if we kind of take a step back and go, I just want to be normal. What can I do to be normal? And you get rid of a lot of the stuff that's creating the imbalances inside your body. Then when your body functions normally, your saliva will be good. Your gut metabolism will be good. Your absorption through your gut will be good. And all of that other stuff kind of falls back into place. And it's a journey. It's not going to happen overnight. But healing your mouth actually can happen very quickly. People are shocked at how quickly they have changes in their oral health.
Oh, I mean, the tissue, it turns over every couple of days. I mean, it's one of the quickest healing tissues in the body. I mean, not so much the teeth, but the oral mucosa and the gum line.
And it has to be because it's exposed to all those acids. I mean, it has to be like that. So it's no surprise. It's no surprise that we can fix these things.
Yeah, absolutely. I love that you said people need to learn to basically take responsibility and like quit blaming genetics, right? Quit blaming their mom and dad. Now you can blame mom and dad for teaching you the wrong things, right? But you can't necessarily blame them for giving you a bad set of genes. Your genes are a gift from God. And it's time to take ownership of your gift, right? And really just move forward in a positive way.
Yeah. And I always say too, that now that you know this information, what are you going to do with it? Because for me, a lot of times, this is how I started my company. Now that I knew that there were toxins, I can't go back. I could never put that stuff on my face. I could never put that stuff on my body or my kids. I couldn't put it in my mouth. So, now that you know this information, what are you going to do with it? It's either time to make a change or nothing's going to change and you're going to continue to go down that path.
Yeah, absolutely. Couple more questions. We could go all night, but we'll have to wrap it. One of them is, how do you restore meridians if you have missing or root canal teeth?
Yeah, I don't think that you can restore meridians. That's the whole reason that even biological dentists don't really want to do a root canal unless it has to be done. Because the meridians, it's that connection. And if you think of like a string, as soon as the connection is broken, it doesn't really get restored. So you really can't restore the meridians. And it's not to shame anybody that's had a root canal or make you feel bad for having a tooth pulled or anything like that. It is what it is. But now that you know that you do still have some meridians intact, with the teeth that are intact, knowing that is more powerful. And also knowing that if you do have teeth that are in trouble, that there are things that you might be able to do to save them instead of having a root canal. And like I said, I would always recommend, whenever anybody emails me, I have a tooth that's acting like this or feels like this, or what should I do? My dentist wants to pull it. My dentist wants to put a filling in my daughter's tooth, like all of these things. My answer is always, I would get an opinion from a biological or a holistic dentist, even if it means traveling an hour or so. It's well worth the time, the energy, and the money if you can possibly save that tooth. If not, they will do it in a safer way and use a safer material for the lifespan of the rest of your life and mouth.
Yeah, IAOMT.org
Yes.
is a great website where you can find dentists who are biological in nature or more holistic in nature, but they go through specific training, and that site lists them. I know it's not the only set of holistic dentists in the world, but it's definitely a good organization.
That one's amazing. That's the one I usually send people to, because you can get they have a good database. So you should be able to find someone relatively close to you. If you're in a big city, you'll probably have a better chance of finding a couple options, but definitely check them.
We got last question. I guess this is a referral. So somebody's in Arizona and wants to know the dentist that you use because they want to be able to check them out.
Dr. Eniko, Eniko, Loud, Loud. She's a holistic dentist and a functional medicine doctor. So she's very, 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 very good, but she's in Scottsdale, Arizona. Dr. Eniko Loud. Whole Health Dentistry is her website. Awesome.
Thanks for sharing that. Well, I just want to say thank you, Trina, for coming on tonight. I know you're super busy, and look, I just appreciate you bringing the knowledge. This is a topic that I think my audience definitely needed to hear. And I just want to say again, thank you so much. There's a ton of great comments in the feed. Just everybody's praising thanks on the knowledge and the information that you dropped tonight. So again, just thank you. Thank you for being here. Thank you for sharing.
And I thank you for having me and inviting me. And I want to make sure everybody knows, because we didn't mention it, that you have links to these products that everyone can use. And I suggest you use Dr. Osborne's links, because I'm giving you guys a link that will get you 60% off, but you have to click through his link. The teeth whitening system, and then the detox kit you can get also at a good price, better than the website. So I would suggest, if you're interested in looking at my products, to just click through the links that he has.
Yeah, and thank you for that tremendous, generous discount from my audience. I really appreciate that. And any of you who do want to go check that out, take advantage of that discount, I encourage it.
Yeah. And I always want to honor anybody that's really interested in really learning about their dental health and helping. So I always want to facilitate being able to be a part of that. And if you guys have any questions, support@primallifeorganics.com is my team, my customer service team. You can reach out to them. They're very helpful. If you're not sure about something or have any questions, they're in direct communication with me as well. So you can always reach out, and you can find me on, we're on Instagram, Primal Life Org, and Facebook, Primal Life Organics as well.
Awesome. Well, thank you again for being here. It was fantastic. I learned a little, and that's I always love to learn. So thank you so much for being an expert and sharing.
Well, and thank you for having me. I really appreciate it.
You're welcome. Well, you have a wonderful evening, and we'll talk soon.
All right. Thank you.
Thank you.
Bye.
Bye-bye. So folks, thanks for tuning in to Pick Dr. Osborne's Brain this evening. We'll be back again for another episode next week. I want to encourage you, if you are new to the show and you have not yet signed up for our newsletter, go check that out, glutenfreesociety.org, where you can tap into our newsletter and you can hear from me and hear from us without the risk of censorship. I'm going to put those links up both in the chat feed as also in the video description below. So if you want to go check out Trina's product line and engage in a healthier oral quality of life, I encourage you to do that. Until next week, hope you have a fantastic week. I'll see you next time on Pick Dr. Osborne's Brain. Take care.